Hello, good day everyone. I'm your friend Dr. Katie Yore. There is something for us to learn today. Of course, that's why I'm here. Today we'll be talking about what to do when bitten by a cobra. This becomes necessary because of the unfortunate incidents that happened recently. Cobra bites are a medical emergency caused by venomous snakes of the Elapida family. Cobra venom is predominantly neurotoxic with additional cytotoxic and cardiotoxic effects depending on the species that is involved in the bite. What that means is that the venom of a cobra is toxic to the nerve, to the cells, and to the heart. And so when it is released into the life of the victim, it is able to cause rapid respiratory paralysis and death. So the person is seen not to be able to breathe well, and before you know it, if nothing is done, the person dies. Early recognition and correct first aid followed by definitive hospital management are critical for survival. So coming to snake bites, especially when it is cobra, the things you must not do: 1, do not cut or suck or massage the wound. This is because that will encourage the spread of the venom. Do not apply ice or chemicals or herbal remedies to the part. Do not use electric shock or even alcohol. Ensure that when you are transporting the person to the hospital, you transport to the nearest hospital where they have antivenom and facility to be able to take over the breathing from the person in case paralysis ensues. Reassure the person and immobilize the patient. Immobilizing means keep the patient calm. Anxiety can increase with the venom spreading. So immobilize the bitten limb using a splint, because when you move that limb, it will encourage the spread of a venom. Keep that limb at heart level. When it is higher than heart level, it will encourage the return of the venom to the heart and to other parts of the body. Remove anything that is constricting on the person. For example, remove any ring, bracelet, shoes, tight clothing, anything that will impinge on the person when there is swelling. This is because following the release of the toxin, the person can be swollen. And so you will remove anything that will be tight. You can use a firm bandage distal to the wound. This can also prevent the upward spread or slow down the spread. That is if you are taught. If you are not taught, then you don't have to use the bandage, because you are not supposed to apply a tight tourniquet. It will not help. So when one is bitten by a cobra, these are the symptoms. First, there will be local pain in that part that is bitten, after which that place will begin to swell and there will be blistering. There will not be ptosis, dropping of the eyes. From there, a blurred vision. When the vision is becoming blurred, there will be difficulty in swallowing. Before you know it, respiratory muscles are paralyzed. There will not be slurred speech and the person will not be able to breathe. There will be generalized weakness. The severe complication is that of a respiratory failure, cardiac arrhythmia, shock. And if nothing is done at this time, the person is definitely going to. So the definitive management, you will have to give antivenom therapy. This antivenom therapy also got indications. The indications are: 1, when you are now beginning to see the person is paralyzed and there is ptosis, and when there is rapidly progressing swelling, and you are seeing systemic symptom of that toxin, then you have to quickly give the antivenom. So administration: use appropriate polyvalent or cobra specific antivenom. IV infusion under close monitoring. Be prepared for anaphylaxis. These are drugs that are now given in the hospital, following which there will be airway and respiratory support. Early oxygen supplementation is important, and the tracheal intubation and mechanical ventilation is life-saving when there is now weakness of respiratory muscle. Do not delay in intubating and ventilating the patient. What that means: do not delay in connecting this patient to life support, otherwise the patient. So the supportive care will be: you give fluids, you give pain relief, you give tetanus, that tetanus toxoids, you give antibiotics only if secondary infection is evident. Then you do wound care, they care for the wound, clean the wound with antiseptic, surgical consultation for necrosis of compartment syndrome in case the person is swelling and not having compartment syndrome. Avoid early debridement or less clearly indicated. Then you continue monitoring and follow up. Key take note points: cobra bite is a life-threatening one, but survivable with early care. Do not use harmful traditional practices. Anti-venom and airway management is the key. Early hospital referral is crucial, and this will help you live above the consequences of the venom. But something you must know is that even in the best of countries of the world, people still die from cobra venom with late presentation. So please keep safe. Ensure that you are sharing this video so that others can learn and know what to do when this happens. But I will tell you, prevention is better at all times. Keep your environment clean and ensure that you practice regular fumigation that will work against reptiles and all other poisonous, venomous snakes. Hope you have learned something. Share with others so that they can learn. Bye.